Trauma can have devastating effects on people's lives, and it's not unlikely that most any common occurrence can trigger some sort of PTSD on those who have suffered trauma. Most of us will have had people in our lives that have experienced trauma, so it's important to know how to effectively communicate with them. And depending on a survivor's specific experience, different things may require different responses. My name is Justin Gilliam, and this is going to be regarding how to effectively communicate with trauma survivors. First thing that we'd want to look at is going to be body language. It's important to be aware of what kind of vibe we're putting off as far as our body language goes. We want to be aware that they're probably hypersensitive to nonverbal communication. So we're going to be looking at distance. Intimate distance is probably going to be the closest of perceived distances according to the textbook Interplay 14th edition. And that's probably going to be something that's going to be a little bit more threatening to a survivor of trauma. So we're going to be looking more at trying to keep a social distance. That's comfortable. It's a notable distance for people that with high anxiety like to keep. And then we're going to be looking at your body movement. How we habitually move could be threatening to someone with PTSD. And so we're going to be, focusing on posture and gesture. Like leaning in is not something that you want to do. It's going to feel threatening to the person. So we want to make sure we're giving an acceptable amount of space, being mindful of our aggressive posture and gestures. Facial expressions, you want to make eye contact, make sure we're showing genuine concern, let them know that they are being listened to and that what they're saying matters. Communication competence, having the ability to be able to obtain the goals that you've set is fitting and productive. So showing empathy, pretty much just going to be showing the speaker that we identify with them, that what they're saying is not lost on us, and that we actually essentially can feel for them. Trying to monitor ourselves, so self-monitoring. It sounds a lot like what it is. It's essential to empathy, being sure not to unintentionally cross boundaries for people. And then showing some understanding. So we want to make sure that we remain open and engaged and make every attempt to dial in on their emotional and mental waves on each individual. So again, you want to keep in mind that different types of trauma can require different types of responses from somebody who's actually communicating with someone who has trauma. So we're going to look at adaptability. It is important to be able to adjust and transform the methods of interaction to effectively suit each person and their situation. So it is really important to select appropriate responses for each situation and select appropriate responses for each recipient. So it's just like any other area of life. The way that we talk, the way that we act, the way that we listen can be most effective for different people in different ways. So that's something that we're going to be, mindful of. So you're going to take note of tonality, personal distance. Each one of these things may be okay with one person where it isn't okay with the other. So it's important to really listen to the survivor to know what we're dealing with. And then, so speaking of listening, it's not just hearing the speaker, but also making what they say important, showing a genuine interest in what they're sharing. So in doing so, we can move into that with questioning, knowing when to ask for additional information, ask to clarify meanings, dig a little deeper into the message of the speaker, ask them to elaborate more on what they mean. Encourage discovery on it, presenting an avenue that allows the speaker to identify what's important in their journey. For example, asking them, so what would be important to you in this aspect? What would a good outcome look like for you here? And then we're going to look into validation, making sure that they understand that we see their thoughts and feelings as relevant. A lot of trauma survivors don't feel like people understand them. So it's important to make sure that we understand where they're coming from. So we want to be attentive and acknowledge their pain and trauma that they're experiencing. And in doing so, we're going to gain trust. So we just continue to practice the things that let them know that we can be trusted and that what they say matters. So again, these come from several different sources. From things that are cited from American Psychiatric Press, from our text on communication. So this comes from a lot of different places, and there's a good chance that most of us have people in our lives who have experienced trauma. So it's important to know how to communicate with those people.